Namaste.
Hi.
So, we'll talk about cancer in women, specifically for women.
Sure.
So, what causes breast cancer? What are the symptoms that people can actually see if at all they have something they can in their houses check?
Breast cancer happens to be the most common cancer in women, not just globally but also in India. Previously it was definitely cervix cancer, but in urban registry we have moved to breast cancer, and Bangalore happens to have the most highest incidence of breast cancer in the country. The factors can be classified as modifiable, in which we can actually do something about it, and non-modifiable factors. Non-modifiable factors are the most common factors. A very small, about 10 to 15% would have some kind of a hereditary gene which can cause breast cancer. Other than that, it could be late marriage, no breastfeeding or very less breastfeeding, or having kids late in life. These are the non-modifiable factors.
And is it a myth? I've heard people saying that if a mother has a kid and if she's not feeding after, say, 3 months, and the milk that is being produced for a couple of months after that, and if it's not utilized, there are high chances of getting breast cancer?
Or no, absence of breastfeeding or very sparse breastfeeding is definitely related to breast cancer. However, feeding for 3 months, it cannot be quantified.
It cannot be quantified. And a normal lady, people seeing this, tumba jana noಡ್ತಿರ್ತಾರೆ, ಕೆಲಸಕ್ಕೆ ಆಗಿರಬಹುದು, college students ಆಗಿರಬಹುದು, it can happen to anyone. So our ಮನೆಯಲ್ಲಿ, what can they see, what can they think that something is wrong with me? What are the things that they can identify with in their houses and then make sure that they go get their test done?
The age can be from any age to any age. However, interestingly, in our country, it happens a decade earlier. So if the most common age in a Western setup will be, let's say, 50 to 70 years, in our country, more than 40 is the common age group
more prone to
have breast cancer. Again, as I said, a family history would be very important. Importantly, all women above 20 should be educated to have a self-breast examination.
Okay.
Because the most common presentation is a painless lump in the breast. There's something which is felt, which was not there in the previous month examination or the past 1 year examination, and there's a lump which is new finding, and that is brought to hospital or doctor's notice. All women over 30 should come for a clinical breast examination, in which a clinician does examination in a particular manner. If there's anything suspicious between 30 and 40 years of age, we would possibly recommend an ultrasound of the breast. But anybody over 40, starting from her 40th birthday, should have at least once or 1 in 2 years a mammogram, which is like an X-ray of the breast.
Okay. And having breast cancer, usually what's the percentage of people which will spread into other vital organs?
In India, we commonly come across almost 30% of the patient would have either stage 3 or stage 4 breast cancer at presentation. So we actually examine them and we find a breast lump. In the first setting, we do a biopsy and it confirms as breast cancer. However, the staging investigation will find out that it's spread to other parts of the body.
So it is 30%.
30% or probably higher than that.
Absolutely. So generally for women, people seeing this as a common man, what are the things that you would advise for young women as well as the old who's watching this, so they know that these are the 2-3 things that they need to incorporate in their day-to-day life?
Most importantly, self-breast examination done monthly. Second thing is clinical breast examination. Just come to a clinician for not just breast, a routine physical checkup, 1 in 6 months. Annually, over 40, a mammogram is recommended. If any woman has any kind of not just breast cancer history, but any kind of cancer history in the family, they should visit an oncologist for a counseling and find out relevant history which can be pertinent to them to make it high risk.
Cancer is curable, and with science and technology and the hospitals getting into more and more forward, so I hope the success rate and life increases. That's what we're hoping, that the message gets spread. Thank you so much for talking to us.
Thank you.
ಮೂರು ಜನನು ಎಲ್ಲರೂ ಇಷ್ಟ ಇದ್ದಾರೆ, ಲೈಕ್ ಬಿಕಾಸ್ ಐ ಹ್ಯಾವ್ ಅ ಡಿಫರೆಂಟ್
Definitely not.
I know, I